Okay, America, this is going to be one of those videos that you're probably going to find annoying because you hate to hear that your systems could be improved. But let me tell you a little bit about interacting with the medical system here in Spain. So, for a little context, in the United States, I spent about $1,200 a month to get insurance. Now, that's this cost that's hidden in this interesting way, because your employer provides you with health care, with health insurance there often, for most, folks who have health insurance. And so it seems like, oh, that's free. No, it's not. I can tell you for a fact, as somebody who was involved in union negotiations, they simply say, okay, what can we give in pay increases? Now we take out the amount that we're going to spend on insurance. That's what we're going to pay you. So you are absolutely paying for that. You're paying for every penny. Now, this experience of going to the doctor today in Spain gave me a little bit more insight into what you are paying for. So one of the complaints that Americans often make when they're thinking about, going to a system like everywhere else in the world, you'll hear the insurance companies pay a lot of money to lobby and make ads and persuade people that, oh no, you'll have terrible wait time. So let me tell you about my wait time. I called up a doctor that was listed in my private health insurance. I have private health insurance here because I'm an immigrant. I can't just immediately access the public system. So I call up the doctor that's listed through my private health insurance, and I get the doctor himself on the phone the very first time I call. 2 rings, he picks up, and he says, oh, sure, I'll see you on Wednesday.
Turn left on
That's it.
a
2-day wait time, right? So immediately I go into the doctor. He says, what's the issue? I say, I need a prescription refilled. Boom, he does that. I walk out, I'm finished, right? But before I leave, we get to talking a little bit about the differences in the systems, because this is so wild to me. So, like I said, I used to spend like $1,200 a month to have medical insurance in the United States, but I couldn't see it, right? It didn't show up as a monthly expense. It was just a pay cut of $1,200. Here, to insure 3 people cost me $300, roughly, right? That covers everything. And the doctor and I were talking about the fact that that $300 is unusual. In fact, he was kind of annoyed and frustrated that he had to deal with private insurance at all. He would much rather have dealt with public, because now he had a card he had to put in and a phone number he had to call, and to make sure he got paid by my private insurance. Most of the time it's just a standard, he enters a number, boom, and he's done. So this was a different kind of number and a different phone call, and that to him was annoying. And here was another thing that was really striking that I think Americans need to consider. When I went to the doctor's office, guess how many people worked in that office? 1. The doctor. Not only did he answer his own phone call, there was nobody there processing medical records. There was nobody there billing insurance. You have all these people who are intelligent, educated, potential employees in other industries working just filing paperwork so that a CEO can get a profit. It's bonkers. There's no need for those folks to do that kind of work, and yet you're devoting all of this skill to processing paperwork, to billing insurance so that the doctor can get paid. So the next time you're at your doctor's office, look at how many people work there to do the work of the doctor. She could do everything by herself, right? If you didn't have this ridiculous system. So the doctor was then explaining to me a little bit about the difference in the system, and here in Spain, he said, if they found a person who was, houseless on the streets, Spain is not perfect. There are people who do not have homes, and they found that that person had an incredibly expensive medical condition. They needed a transplant of some kind. They would simply give it to them free. Not only is it covered by taxes, but there's a value in recognizing, hey, we all then get to live in a country where there's not a person who needs a transplant. So they just provide it to everyone. And once we have residency, we'll be on that public system as well. We just have to prove that we're here and paying taxes and contributing to the society that everyone wants to be a better society. It makes so much more sense. So, when you hear somebody talking about universal health care, this is not some crazy pie in the sky, wild liberal idea. This is just a good, practical idea that just about every other country in the world has figured out. It doesn't make sense to add layers of unnecessary bureaucracy to your system just so a CEO can get a cut on private medical insurance, which is superfluous. It's just rent-seeking. You don't need it. So now I'm going to go to the pharmacy, and I'm going to pick up my prescription. And do you know how many meals I'm going to miss because of the copay on that prescription? None, because the prescription is entirely covered by that $300 a month insurance, and all the medications here are much, much, much less expensive. So again, you don't need to be paying what you're paying. This is a choice very wealthy people have decided for you. And they've decided you need to pay this incredible amount so they can line their pockets. It's a ridiculous system. And on that note, maybe I'll stop and get some dinner. I mean, I could stop and get a dozen eggs for $2, but I think I'm going to get something else. Oh, part of the reason that your insurance is so expensive, and I should have held the camera out further so that you could see the people that I'm passing as I'm walking through the streets, is that if you take on that value, that nobody around you should need some incredibly expensive medical treatment and not be able to get it, you will be paying for medical care for people who have different color skin and who are speaking different languages and who are different genders, and that's something that Americans find really uncomfortable. But guess what? If you can decide as a society that everyone should get care, then you get to live with everyone, which is pretty freaking great.